Good morning. My name's Olivia. I'm known as Olivia K on Facebook, Ollie K on Facebook, Instagram, I mean. Silly. And Warm EM 9800 on Reddit. So I cover nursing related topics, including NCLEX, nursing school materials. I also cover reality TV shows because we have to all decompress when it comes to nursing. It could be a lot. And then I also cover documentaries and I talk about movies. There's this one movie I watched on Netflix, and I'm probably going to cover it sometime next week because I think it's a feel good watch, and it's one of the most feel good movies you can ever watch in a long time, honestly. So I will cover that next week. It's called Remarkable Creatures, something like that, and it has Sally Field and Lewis Pullman. So I'll cover that next week somehow because it's worth the reviews on it. And then cover obviously more like Med Surg related materials, and I do eventually want to cover some maternity stuff that you should know, in pediatrics and psych is my favorite topic because I work it all the time and I love to go into that, so I'll hopefully dabble into it very soon. But for now, today's topic is going to be Addison's versus Cushing's. So as you know, I'm comparing the diagnoses because you'll see more of them in NGN style questions, and it's important to know. The thing is, like the NCLEX is kind of unpredictable, to be honest, because it can ask you any kind of thing from fundamentals to Med Surg to pediatrics and maternity. But it's important for you to know some key things, some key topics from each topics, because of the fact that it can ask you, and it's important for you to know and use your nursing judgment to be able to answer the questions. So that's why I've been doing the comparing the two and making this a series. So this is the third video of the series of Med Surg, compare and contrast. So I'm going to do Addison's versus Cushing's because they will, if even you don't see this in the NCLEX, you will at least see this on your ATIs and your nursing Qbanks. So with that said, we're going to get right into it right now. I'm going to get right started into it. So what's the key difference between the two disease processes and how do they relate? Addison's disease, that means the body does not have enough of the cortisol, right? There's little of it. In Cushing's, polar opposite, just like the past two videos. So this is the polar opposite. It means the body has a lot of cortisol. There's too much of it, okay? So something you need to be aware of with Addison's, because it's easy to confuse the two, so which is why NCLEX makes you kind of do these kind of questions, so that way you are aware of the differences and how to treat this patient, no matter the scenario they're giving you on either Qbanks, ATI, and NCLEX. Because again, you could see this. It's possible you can see Addison's or Cushing's in the questions, right? So with Addison's, everything is lower except the potassium, okay? So you're going to see hypotension. You're going to see weight loss, weakness, and fatigue. Sorry, I just got a text message. Low sodium. So star and underline these 2 points. Low sodium, high potassium. And then this is a distinct feature you're going to see also with Addison's: bronze skin. Okay. So this is what the treatment is for Addison's. Hydrocortisone. So that's for mostly involving like the cortisol, treating that, and maybe helping the body have more cortisol. And fludrocortisone, aldosterone. So that's what's going to help. Jeez, this text message is distracting me. Okay, so this is a star, another line point that you need to know. If this person is to have surgery, they're going to need a higher dose of steroids, of corticosteroids. So remember how I said in my cortisone or prednisone, cortisone shorts that they might need a higher dose of the bodies than any stress whatsoever. I might have mentioned it. So they will need that. And also, so we're also going to start and underline this point. This patient can go into what's called Addison crisis. So that's when the body's in a lot of stress, right? They need the cortisone. They're going to need the cortisol. So this is a medical emergency, okay? So this person, start underline this. So that's why I mean this is a start underline moment. And please pay attention to this part. They need IV cortisone, okay? They're going to need normal saline because they're dehydrated. And they're going to have what's called severe hypotension, as I just mentioned now. And they're going to be very hypoglycemic. So they need IV dextrose. And you need to monitor the potassium, okay? Because the potassium is going to be sky high. As I said before with potassium, it's at high risk for severe or dangerous arrhythmia. So, which is why you need to pay attention to this. This is a medical emergency. So once you see these symptoms, you need to get them into emergency care right now. Okay, don't delay treatment. Never ever delay treatment. And then now with Cushing's, is a completely different polar opposite situation here. So now everything is higher except the potassium. Potassium's going to be a little low. So you're going to see hypertension, hyperglycemia, weight gain, truncal obesity, thin skin. So their skin's pretty damn thin. Okay, so they're prone to disease and prone to infections or bruising and cuts and stuff like that. That's what I meant to say. They have the classic buffalo hump. Okay, and then again, star and underline this part. High sodium, low potassium. So the treatment for Cushing's would be you want to identify the cause, see what's going on, because the treatment is to get rid of all that excess cortisol. So unlike Addison, they have a lot of the cortisol. The Addison, they're missing it. So with that, you're going to monitor hyperglycemia, hypertension, and then again, I just said the skin gets thin. So you're going to look for infection, and then plus they're on the corticosteroids, so you want to monitor for infection anyways. And then then fluid retention because they're accumulating a lot of fluids, and hypokalemia. And of course, there's some also risk with hypokalemia. Again, you can have dangerous cardiac issues coming up with the hypokalemia and arrhythmias, so watch out for those. And then now this is an important point you need to understand. You cannot just suddenly stop corticosteroids, because I know I did mention this in my shorts. Do not ever stop, because you'll get into what's called rebound crisis, something like that. Correct me if I'm wrong, but that's what you need to know for the Addisons and Cushings, okay? So I'm going to leave the links below for helpful tips, for other helpful insight besides from mine. And I'm going to cover this next one, nursing lecture, I'm going to rather cover, and it's going to be a lot. So it's differentiating between the 4 different disease processes. So that would be, I don't know, so Parkinson's, Lewy body dementia, MS and MG. I think that's very important because it's easy to confuse all those 4 different disease processes. And it's going to be a really big video I'm going to do next. So that's probably going to be for tomorrow. But anyways, if you need any additional help with nursing school related materials and NCLEX, if you need me to go over your CPR report, there are my links to my Facebook, Instagram, and Reddit. So I'll be left below. All right, have a wonderful rest of your day and take care. Bye.